And sometimes people wonder why their doctor will give them multiple medications for the same condition. Today we have Dr. Quinn to talk about some of those benefits versus the risk. Good morning, Dr. Quinn.
Hey, good morning.
So why do doctors give multiple medications for the same condition?
You know, I get this question so often. Ironically, I got it about an hour ago this morning, and I explained to the patient a scenario. I asked a lady if she's ever had her car stranded in mud, and she said, that's happened to me before. And I just asked her to imagine calling her husband to come push the car while she tries to drive it out of the mud. And he comes and he pushes and he pushes and it just doesn't get out of the mud. And then he calls his brother. His brother comes, he's the husband is in the middle, the brother is on one end pushing, but the car is not moving. Then they call the second brother, which is the third person. Now you have three men pushing the car, and the car gets out of the mud, the lady gets back on the road, and she drives away. I said, compare that to blood pressure. Sometimes we start out with one pill, and the blood pressure will come down some, but it's not where we want it. Then we might add another pill, and it comes down a little bit more, and then we can add a third agent, and it comes down even further, and now the blood pressure is controlled.
That totally makes sense, Dr. Quinn, especially when you put it like that in easy to understand analogies that we all get. But is there anything maybe that could go wrong when you start adding medications? Could there be any complications when you have multiple medications?
Most definitely. Now, there's something called the synergistic effect. That means things are working all together for one objective. In the case, we're talking about blood pressure control. The lower the dose you use of the medicine, the research has proven that the lower probability that you'll have side effects. So by using multiple medications with multiple mechanisms of action, there's less of a chance of getting those side effects. And note that specifically, an example would be the lady that I was talking about on 3 medications. The first medicine that we started was a calcium channel blocker. It was amlodipine, but we started at a very low dose. What it does is it causes the blood vessels to dilate a little bit more, which decreases the pressure some. The second agent we added was a beta blocker, metoprolol. What it does is it causes the heart to beat a little bit less hard, meaning that the pressure typically will go down a little bit more. And then the third agent was a diuretic, hydrochlorothiazide. And what it does is when you urinate, it causes you to lose more volume, which decreases the blood pressure a little bit more. These 3 different medications with 3 different mechanisms of action all work synergistically to help her get to a healthier blood pressure, which makes her more safe as far as not having a higher probability for a heart attack or a stroke. So using the 3, we can go with the lower doses, which has a lower probability of having those side effects that we don't want.
That definitely makes sense, Dr. Quinn. And why is it so important that patients let other doctors know what all they're taking, especially if they're changing physicians or if they've been seeing the same one for many years, just to let them know that updated list of medications? Why is that so important?
I'm glad you said list. We don't like list. We want you to bring the bottles. The bottles are so much better. Example would be a patient that I follow. She's seeing a cardiologist, a nephrologist, and me, the family doctor. But the deal is, when she goes to these different doctors, sometimes the doctors will prescribe a new medication and want her to stop one of the medicines that she's currently on because they're looking at, and for example, the nephrologist, they're looking at the kidney function. If the patient would just bring the bottles, we could see the actual medication, we could see the date it was prescribed, the doctor that prescribed it, and you know, it really makes it so much more clear. Ideally, the kidney doctor or the nephrologist would send us a report, but sometimes they're so busy, they don't have time to send a report. And right. You could call the pharmacy and be on the phone for 30 minutes. They don't never answer. Bring the bottles, and we could do a better job.